So I get asked all the time, how do I know if my kid has ADHD? And it's a complicated question because there is no blood test, there is no real test. It's up until recently, it's been based on a series of questionnaires that are given to the primary adults in the person's life to determine whether they have ADD or ADHD. Just this year, the first ever brain scan has been approved to help diagnose ADHD. And what that essentially does is look at two brain waves, the theta wave and the beta wave, and compare their ratio right here at one spot. With our brain mapping evaluation, we look at all four brain waves at 12 spots all over the head to get a more comprehensive picture of what's going on. And typically with kids with ADHD, they have dysregulation in the frontal lobes, sometimes the temporal lobes. But I think it's an important question because how do we know? What's most often given to these children are stimulant medications that tend to ramp up the beta waves and some of the higher waves to bring that ratio more in alignment so that they can function better in life and in school. But you're taking the stimulant medication and it balances the brain waves. There are other ways to balance the brain waves. I think we, particularly in this country, we are 5% of the world's population, and we consume 85% of Ritalin and Ritalin type medication. That's off the chart to me. And it's not because we have more ADHD, it's because we choose to treat it in that way. If we have a prescription for treating these brain waves with kids with ADD and ADHD, over half the kids I find in here are not a typical pattern. It's from some other dysregulation at some other point. And when we balance that, the symptoms balance. Whereas if we were just treating where we might think most kids need it, we would be effective maybe 70% of the time without the testing. But we have the ability, and it's one of the things I love about BrainCore is I do the scan every time with everybody and treat everybody as an individual.